visiting senior medical doctor in person of Engineer Augustine Osayuki, a senior medical officer in Akoso Comprehensive Cancer Center. And the theme for today's webinar is knowing the early signs of breast and cervical cancer. As we all know, cancer is an uncontrollable disease which is abnormal in the sense that it grows from all the cells in the part of the body and can easily spread to all parts of the body. And before I want to start, I want us to know that to me, I see it as evil and a destructive practice because it's very difficult to remove. But you and I know the early signs. It goes a long way. It helps to increase the chance of successful survival for the treatment and also a likely better outcome. So today, our guest speaker will be taking us through to meet us concerning us knowing the early signs, the importance, so that you and I will be aware. Without wasting much of our time, we have another program for today. However, we have opening prayer as a starting point. So please, we are going to be taking the third standard of the national item. Sorry, is this? Sorry. Okay. That was the... Please, the count of three, let's go ahead to read the national item. 1, 2, 3, let's go. Hello. I know the early signs. Hello? Hello?
Even our national anthem.
Yes, it's on. I shared it, man.
Okay.
Yeah, it's on the screen. The national item.
It's called National Anthem. National Anthem. Do you want us to sing it, or you want us to take the third stanzas and pray with it?
The third, yes. I said the third national anthem, please.
Okay. O God of all creation,
Grant this our one request.
help us to build a
nation
when no man
peace
Christ,
of France
and so with peace
and plenty.
Nigeria
may be blessed.
Amen.
Amen. Please let us learn this thing by heart. It's very important. We are Nigerians, and this is so important to us. Thank you.
Next, we have is meeting etiquette. That's the safety tips. Because it's necessary we are able to guide ourselves as engineers, because safety tips is a guide, a conduct to guide us, to enable us to have a direction for us to be guided as we're having this webinar. So we'll be calling on Engineer Bisiola Awosobi for the safety tips. Thank you. 2 minutes, please.
Yes, ma'am. Good morning, Good morning, Mass. Good morning, sirs. Please permit me to stand on the existing protocol. Let's listen to the meeting protocols. Pay attention to the mute function throughout the duration of this meeting. Kindly mute yourself and only unmute your mic when you are called upon to speak. Avoid eating chewing gum and drinking when speaking while on the call as courtesy to others. Kindly put off your video if the view is not okay. If you are on transit, endeavor to use a headphone to improve your audio and filter out background noise. Kindly use the chat box to share your question and contributions, which will be read out at the end of the lecture. Alternatively, you can raise your hand to notify the host of your intention to speak. Avoid or minimize distractions around you as much as possible. Here are our safety briefs. As engineers, safety remains our watchword. Therefore, it is pertinent that you are familiar with some of the essential safety briefing. As part of virtual meeting safety, attendees are encouraged to drop their contact information with the host in the case of an emergency. Ensure that the electrical gadgets you're using for these virtual meeting phones, laptops, have been disconnected from the power source. If possible, avoid driving while on the call. Please remember to check your blood pressure and sugar level periodically to avoid casualties at work. Remember to always carry water bottle and emergency healthy snacks in your bag to stay energized throughout the day. Always try to observe 30 minutes to 1 hour break at work to avoid stress. Always get as much sleep as possible to rest for the next day. On behalf of our President and Chairman of the Technical Committee, I welcome you all and hope you have a truly enlightening and rewarding session. Thank you.
Thank you very much for that safety brief. We appreciate you because it's a watchword for all engineers. Without wasting most of our time, I want to call on our technical secretary in person of Engineer Dr. Tululokwe Rinosho to please introduce and recognize other guests present today for this
Audio and filter out background noise. Kindly use the chat box to share your question and contributions, which will be read out at the end of the lecture. Alternatively, you can raise your hand to notify the host of your intention to speak. Avoid or minimize distractions around you as much as possible. Here are our safety briefs. As engineers, safety remains our watchword. Therefore, it is pertinent that you are familiar with
Engineer Dr. Tululokwe, over to you, please. Can you hear me? Engineer Tululokwe.
Good morning, distinguished participants. It is an honor to have you join us this morning for another interesting topic which concerns every individual that is on this, especially women. My name is Tululokwe Meshu. I'm the technical secretary of the association, and it is my pleasure to be here this morning. On the call this morning, we have an array of distinguished professionals who have joined us from all walks of life, both from the
Excuse me, good morning. There is another meeting going on in the background. Where is that coming from?
I think we are having an interference.
Yes, there's an interference from another source.
I can observe an interference.
To speak. Avoid or minimize distractions around.
Hello, can you hear me, please?
Okay. Yes.
Thank you.
Thank you.
I think the interference is gone now. Yeah, sorry for that disturbance. Good morning once again. It is an honor to be here this morning. And joining us this morning, we have an array of professionals from all walks of life, both within Nigeria and our international communities. On the call this morning, we have the president of the association, in person of engineer Dr. Adebisi Al-Osim, the woman who has been leading the association for more than a year now, and she's doing a lot in reshaping the association in a manner that the association will be a leading association, a women-centered association among the committee of women non-profit organization that we have in Africa. And I think you will agree with me that she is a woman of integrity who has been doing a lot in this space. Also with us in this on this call this morning is the guest speaker for today, who joined us all the way from Calabar, Nigeria, in person, Dr. Augustine Osei. Thank you very much, sir, for joining us. We also have with us some of the members of the National Executive Committee of the association. We have the Vice President of the association, Engineer Nina Igwe, also joining us this morning. Thank you, ma'am. We are so happy to have you on the call. We also have in our midst Engineer Stella Uzochukwu, joining us from Abuja, Nigeria. And also with us this morning, we have, this is a miss. I also have done this early, but my apologies, please. We have one of the past presidents of the association who joined the meeting even before we started, in person of Engineer Dr. Patricia Okpene-Odili. Thank you, ma. We appreciate you for joining us this morning on this important topic that concerns our well-being as women. We also have in our midst some national, one of the FAD leader of the association, the person behind the website's management of the association, person of Engineer Obianoju. Thank you very much, ma'am. We are so glad to have you. We have members joining us from the guest speaker side, which I believe when he comes on board, is going to do a formal introduction of some people that joined from his own space. So without much ado, on behalf of the National Executive Committee of the association, I warmly welcome all of us to this important discussion. And I want to implore us to please let us sit back as we enjoy the rest of the webinar. And when we have questions to ask, we can use the chat button, or we can use the virtual raise hand icon to drop our question. Thank you very much once again for joining us, and I wish us a fruitful deliberation in today's webinar. Thank you. Over to you, Engineer Esosa. Thank you, ma'am. Okay, I think Engineer Esosa, I think she's having...
Okay, I'm here now. Good morning. Thank you very much. Thank you. I'm able to, yes, appreciate you for that recognition. Without wasting much of our time, we want to invite to the podium our amiable president, in person of Engineer Dr. Adebisi Osim, FNSC, to please give her welcome speech. Thank you.
Thank you so much, the host, the moderator of today's webinar. The past president of APWEN in our midst, Engineer Dr. Patricia Okpene-Odili, FNSC, other past president present, founding members of APWEN, the guest speaker of today, Dr. Augustine Osei, past president of NSC, present in our midst, Engineer Olorunfemi, FNSC, moderator, Engineer Odigwe Esosa Christabel, our host, Engineer Dr. Tolu Enyosho, ESCO and council members of APWEN, fellow members of NSA and APWEN present this morning, ladies and gentlemen, good morning. I am truly delighted I am truly delighted to welcome you all to this landmark APWEN webinar on a topic that touches not only our professional circle, but also our families, our community, and indeed our very lives. Understanding the early signs of breast and cervical cancer. I want to extend a special welcome and ask gratitude to our distinguished guests, Dr. Augustus Osayiwu, the Senior Medical Director of ASIPO Comprehensive Center. Your expertise and dedication to the fight against cancer are invaluable, and we are privileged to have you in our midst this morning to learn from you. My thanks and appreciation also go to our incredible team, the technical team, the moderator, and the technical executive, entire association who work tirelessly to make this event a reality. Your passion and hard work and the engine that drives APWEN's mission forward. As the president of the Association of Professional Women Engineers of Nigeria, I am honored to see so many of you here demonstrating your commitment to the cause that affects us all. Today's topic is not just an item on a calendar. It is a matter of life and death. Cancer, particularly breast and cervical cancer, has become a silent epidemic in our society. The World Health Organization reports that breast cancer is the most common cancer among women globally, while cervical cancer is the fourth most common. Yet, the silence and stigma surrounding this illness persists. Too often, women present at hospital too late because symptoms went unrecognized or were ignored. In a world where women are breaking barriers in engineering and technology, it is crucial to remember that our health is the foundation upon which all personal and professional achievements are built. As women engineers, we are often at the forefront of our career and our families. We solve complex problems every day, but let us not ignore the very real urgent health challenge that disproportionate affect women, particularly breast and cervical cancer. Because of our rigorous schedule, we delay checkups, ignore symptoms, and postpone conversation that could save our lives. This is why this webinar is so critical. We are not just here to listen, we are here to learn and to empower ourselves. Early detection is our most potent weapon against this disease. When detected early, both breast and cervical cancer are highly treatable, and the chance of survival are significantly high. A simple self-examination or routine screening can make all difference. Therefore, my recommendation to each and every one of us are threefold. Prioritize self-care and awareness. Make it a habit to perform monthly breast self-examination. Know what is normal for your body so you can quickly identify any changes. Regularly screening. Do not shy away from professional and medical advice and screening. Schedule your mammogram, self-examination, and palm smear as recommended by medical professionals. These are not luxury. They are necessity. As engineers, let's apply our commitment to precision and regularly maintain maintenance of our health too. Spread the word. Let's not keep this knowledge to ourselves. Be an advocate of health in your families, workplace, and community. Encourage women in your life to take charge of their health. APWEN is committed to this cause. We will continue to champion initiatives and promote the well-being of women in engineering and beyond. We believe that a healthy woman is a productive woman, and a healthy society is a prosperous one. I encourage you to engage actively, ask questions, and make the most of this opportunity. Let us leave this webinar not just information, but with a renewed commitment to our health. Thank you all for joining APWEN in this championing women's health. Let us continue leading by example in the workplace, at home, and in our community. Thank you and enjoy the webinar. God bless you all.
Thank you very much, my amiable president. I want to say we appreciate you for that inspiring speech that women should take charge of their health, because if they are healthy, they are being productive, and the society as well will be well informed. But it does not only have to do with female engineers. We go to the extent of saying that even the community, our sisters out there, needs to be informed. Thank you very much. We appreciate you, ma. Well, we want to take the recitation of the guest speaker. From our order of program, we have Engineer Precious Dam Harold. So please take us through the recitation of our guest speaker.
Good morning, afternoon, evening, wherever you're calling. Standing on existing protocols, I would like to read the citation of our very important person, Dr. Augustine Osaiwu. Dr. Augustine Osaiwu was born in Edo State, Nigeria, completed his primary and secondary school education in Jos, Plateau State, and attended the prestigious University of Jos. Graduated with MBBS degree in 2016 and has been in medical practice for the past 9 years. Currently serving as Senior Medical Officer at Asioko Comprehensive Cancer Center. He is married and resides in the city of Calabar, Cross River State. Please allow me, with a standing ovation, to welcome Dr. Augustine Osaiwo.
Sayuki, and Dr. Augustine Sayuki. Thank you very much. We appreciate you. Our doctor, welcome you. Want to say really thank you for creating that time to be our speaker for today's program. Thank you very much.
Okay. Okay, I don't know if you can hear me.
Yes, sir. We can hear you, sir.
Okay. Good morning. Thank you so very much for having me. I think I was called an engineer, at some point. I said, I've become an engineer today by association. Thank you very much. I'll just go straight to the business of the day. Okay, I was told that I have 30 minutes, so I'll just try to round up in I'll try to round up in 20 minutes so that I can maybe take questions. Okay, but I think our president already, she has said most of the things, and I was really impressed. Okay, all of the mammogram, the screening, and and the statistics she gave. Okay, okay, Mark, could you help me share the slide, the one I sent earlier, the one you said the technical person would
Sorry, I don't have it, please.
Oh, okay. I sent it on WhatsApp. The first one wasn't opening, but I sent another one. If you check, I think you'd be able to see it. Okay, okay.
You can drop it in the chat room so that you can pick it up from there.
Hold on, please. I want to displace it. Just be sent now.
Okay.
Hello, sir. Are you having any challenge?
Yeah, well, no, not really. I'm waiting for. Okay, okay,
Okay, it's up now.
okay. All right. So breast cancer is the most common cancer in women worldwide, and in Nigeria too, is the most common cancer in women. And while cervical cancer, after breast cancer, is the second leading cause of death, okay, cancer cause, okay, among women in Nigeria. Now, breast cancer tops the list. So I'm going to spend most of my time, on breast cancer. Now, in our center, that's a super comprehensive cancer center, in July, which was just last month, 30% of all cancer cases that presented was breast cancer. Now, that includes men, every kind of cancer. Okay. Now, that is a lot. Okay. That all the cancer cases that came, you know, 30% of it was breast cancer, at different stages. Now, if you narrow that down to just, if you take the statistics for just women, okay, that goes to around 60%, okay, of the cancer cases in women that came to our center in just July, okay, which is a lot. Okay, that's for breast cancer. While 12% of it in July, was cervical cancer. So in all the cancer cases that came in July, okay, both men, women, and all, 12% of it, okay, was cervical cancer. Now, by the time you narrow down to just women, the women that came, so that 12% will move up to somewhere between around 35% or so. Okay, that's for just women now. Okay, this 12% is all of them, that came. Now, in the second quarter of this year, that's April, May, and June, 37% of all the cancer cases that came was breast cancer, which again is massive. Okay, and then 9% of all the cancer cases that came, okay, all of it, okay, was cervical cancer. Next slide. Okay, now early signs of breast cancer. Now it's important to understand what to do to identify the early signs. A simple procedure known as breast self-examination is done. Now, before I get to breast self-examination, um, the most common sign that people would have, where they don't have to do anything, okay, whether you do breast self-examination or not, is pain. Okay, when you start having pain in your breast, okay, that is not cyclical. Sometimes during your menstrual flow, there are certain periods where, the breast is engorged and then it feels painful. All right. But that would usually resolve, after your cycle. Okay. But when you're having breast pain that is not related to your cycle, okay, that is a red flag. Okay. And you need to go to the hospital, okay, and see a doctor. Now, so that's about the only sign that, whether you are looking out for it or not, you will feel it, it will call your attention. But most of the other ones that the breast self-examination would reveal to you are things you have to look out for. Okay, so I'm going to, spend some time there, in breast self-examination. Next slide, please. Okay, now for a breast self-examination, there are two steps involved. Okay, inspection, palpation. Inspection means to look. Okay, you're looking at it. Okay, what can you see? All right, and then palpation means to touch. All right. Now, so when it comes to touching it, right, there are three patterns, right? There's a clock pattern, the wedge pattern, and the sweeping pattern. Now, the idea of having a technique is so that you can have all the areas of the breast covered. Okay, I won't dwell too much on that. Okay, but that's the idea, the clock pattern, wedge pattern, and then the sweeping pattern. So now, when you're inspecting, okay, you you just stand in front of your mirror. Okay, I'm going to try to demonstrate. All right. I don't know if you can see me, but okay, you stand in front of the mirror. Okay, and then you put your hand on your waist like this, right? And then you're looking at the mirror. Okay, then you turn like this to the right.
Please let's be patient. I believe he's having network issues from his end. Okay. Okay, it's back.
Okay, so I was saying, so when you do like this and then you just slightly up, down like that, right? So you want to see the breast, okay, move up and down. So if I do like this, so you see the breast go up with my hand and then I come down, it goes down. Now, why that is important is because when a woman has breast cancer, one of the things that happens is that the breast is fixed on the chest wall. So if you do just something simple like that, where your hand goes up and then moves with it, it comes down, it goes down, that will not happen. Okay, so it's fixed. All right, so you just do that, for this side, and then you also do, for this side. Now, next slide, I'll come back to the palpation. Okay, now if okay, no, go to the next one. We'll come back to this one when I come to palpation. Let me just next. Next. Yes, good. Now, when you're looking at the breast, okay, what are you looking out for? What are you hoping to find, that should be a red flag? Okay, one of the things you're looking out for, first of all, is redness on the skin. Okay, the skin, around the breast. You're looking, is there any area that is looking, is red, which is a sign of inflammation. Now you look for discharge from the nipple. Okay, now it becomes very worrisome if the discharge is bloody. Now, of course, if the woman is breastfeeding, and then there's something coming out of the breast, you won't be alarmed. But a woman who is not breastfeeding and then the woman is discharging, okay, you would want to come to the hospital for proper checkup. Now, if it's bloody, there's bloody stuff. It may not be frank blood, it might just be pinkish like that. That's a red flag. Now, then changes in the feeling or appearance. Okay, sometimes you look at the breast and then you see like a dimple. Okay, you're looking at, is there any dimple? Is there any puckering? Okay, does it look scaly? Okay, you're seeing scales, and all of that. That's a red flag. Okay, and then there's something called orange peel appearance. Okay, can we quickly just jump to the next slide and come back? Would that be possible? So that it would make sense. Yes, slide 9. Okay, good. So this is what an orange peel appearance looks like. So if you look at it, it actually looks, like an orange. Okay, so these are some of the things you're looking out for. Go to slide 10, please. Good. Now, this is nipple retraction. Okay, as you can see. Now, this woman's nipple has gone inside, right? So the nipple is retracted. This is one of the things that you're looking out for. Okay. Okay, so let's go to the next slide. Then I'll go back. Now, if you look at this image very well, okay, it summarizes all of the things you're looking out for. Okay, changes in skin color, you're looking out for discharge from the nipple, okay, and then you see puckering, and then you see retraction or indentation of the nipple. All right, so these are some of the abnormalities, that you're looking out for. Or if you find something in your breast, maybe that I've not said, it was not always there, okay, but all of a sudden it shows up, okay, whatever it is, okay, it's good to be proactive, and then you get to the hospital. Please go back. I think slide 7 or so. Okay, no, abnormal findings, slide 8. Slide 8. I'll come to palpation. Okay, so redness of the skin, discharge from the nipple, we've said that. Changes in the feeling, appearance, dimples, scaly, orange peel appearance, we've seen that. Then during the palpation, I'll come to the technique for the palpation, but since we're here, let me just mention it. Maybe you feel a lump. Okay, this is the one that is commonest. Okay, people do the examination and then you feel a lump. Okay, and then an axillary swelling, meaning your armpit. Now, when you are doing a breast self examination, you have to touch your armpit. Okay, you have to go in there, okay, and feel for any swelling. Okay, the reason is sometimes, right, in rare cases, okay, the woman could have a breast cancer and then she's not feeling anything, okay, in the breast, but because it has already spread, to the lymph nodes, their axillary lymph nodes, okay, those ones could be swollen, and you can pick that up, during your breast self-examination. So it's not just the breast, you're touching. Okay, you also touch, the armpits, you press it deep in like that firmly. You're looking out for, for swelling. Now, another thing you're looking out for is change in size, the shape and contour of the breast. So as you're standing there in front of the mirror, you're looking out for, wait, is one breast bigger than the other? Okay, sometimes the only thing that will happen is that the breast loses its normal shape. Now, a woman would know what her breast looks like normally. And then all of a sudden, it begins to look like it's losing shape, or the contour changes. All right, so you also look out for that. Now, lastly, nipple areola changes. Okay, I already talked about nipple retraction, where the nipple goes inside. Now, another thing you look at that nipple and then the areola area. Sometimes that's the only place where you see something that is different. Sometimes that place is discolored, is darker than it should be. Okay, it just feels thick and firm. And so you look out for, changes around the nipple and the areola. Now, let me get to the technique for the for the palpation, right? Now, like I said, the idea is you want to cover all the zones of the breast. Okay, you don't have to know the name. It really doesn't matter. I won't go into details of all of them, but the idea is that all the zones are covered. Now, for the clock technique, right? The idea is you look at the breast. Okay, let me see. Okay, good. You look at the breast, assume it's a clock, right? Like a clock, right? And then this is 12 o'clock position. Then this is 1, 2, 3, like that, like that, like that. You're going around. So you want to start from the 12 o'clock position, okay? And then you just feel, you just feel it. You just touch like that. You move towards the nipple, okay, from 12 o'clock. Then you move over to 1 o'clock position. Okay, you just feel it, firmly down like that. You keep going, then clockwise like that. So you go round like that. Now, when you want to do this, right, you just put your hand behind your head. Okay, when you do that, the breast, comes up, right? It comes up. Now you can do this sitting or lying down. Okay. Now, when we usually advise, I think it's in the next slide, for women usually in the bathroom when they're having their bath and slopey, so it's easier for your hand, to just move, on the breast like that. All right, so you put your hand. So if I want to examine this, my left, so I put my left hand back of my head, the breast lifts up. So for my 12 o'clock position, I just go down like that towards the nipple. I go like that, like that, like that, like that, and then you just, or another technique, you can just go in a circular pattern. Okay, I go like this. Okay, instead of coming like this towards the nipple, I go like this. Okay, and I go in smaller circles, okay, towards the nipple. So that one is like this. You're just going. So, but the basic idea is that, all right, all the zones are covered. Okay, so whichever technique you decide to use, the idea is ensure all of the zones are covered. And like I said, don't forget, to touch, your axilla. Then of course you come over to this side. You do like this, you raise it, and then you just continue like that. You feel, and then you now check. All right, so let's go to take me to okay, let's do slide 6. Okay, let's do slide 6. Okay, so this is just a pictorial representation of what I already talked about. These are the different patterns. You see the arrows, and then you can see the woman there, her left hand is raised, with her hand, just so that, it gives the breast like a lift. And then you just feel. You're looking out for those lumps. You're looking out for sometimes what you feel may not necessarily be a lump. You just feel that there's a thickness. Okay, one area of skin is thicker than others. Okay, so you feel for that. Then next slide, please. Slide 7. Okay, good. So this is how you do it when you're lying down. Okay. Now, the woman lies down, right? From what you can see here, there's a picture. She's on her left side. She wants to examine the left breast, right? Hand is behind her head. She's lying down again to give that lift. And then there's a pillow there. And then, she just, does the same pattern. The idea is so that whichever one is better for you, whether it's standing, lying down on your bed, you can still do it, so that, it will be very convenient. I mean, if you can do this on your bed, right, whilst, you're lying down, people, we lie down every day, we sleep every day. So it's something you can do. Okay, we have a bath every day. Okay, so I usually will advise my patients to do it in the bathroom. Okay, because most bathrooms have mirrors. Okay, you can, look in the mirror, because you look first before you touch. Now, the thing about doing it while you're lying down is you may not have a mirror there, to look first. But if you can incorporate it into your usual schedule, where it's part of your bathing routine, okay, to help you. Now, we advise once a month, okay, once a month, preferably 1 week after your menses. Okay, for women that are menstruating. Okay, the reason is because during your menstruation there are hormonal changes in the breast, and then you want to wait for all of those hormonal influence on the breast to settle down. Okay, so once all of the everything has gone, like a week after, perfect time. Now for women who are no longer menstruating, right, they can fix a day, okay, in the month, okay, where they'll be doing it, maybe first, maybe second, where they'll be repeating it routinely. All right, so let's go to next slide. Okay, okay, we've talked about this one next. I think there's a slide I missed. Okay, go to slide 4. 4. Okay, there's something there I just want to show us. I think I missed that. Slide 4. Okay, is that 4? Okay, good. So breast self-examination, simple procedure that helps identify changes in the breast, such as lumps, size, color, rash, etc. Now, about 70 to 80% of lumps are not cancerous. Okay, they are not. But it doesn't mean that you should leave them. Some of them can undergo malignant transformation. Okay, but it suffices to note that 70 to 80% of the lumps you're going to find are not cancerous. Right now, done once a month by women aged 20 and above. Now, there's a new teaching that is advocating that ladies in their late teens, maybe 18, 19, can start, breast self-examination. And the rationale is we're beginning to find that there's a change, okay, in the demographic of people who are being affected by cancer. We're seeing it now in the younger age group. I have a secondary school classmate, that died recently of breast cancer. That lady is about 34. Okay, which she died of breast cancer. So she had battled it for years, was on treatment and all of that. And then, she eventually gave up, when she was 34. So because of that, we were seeing it younger people. So we're like, okay, late teens, can also, do a breast self-examination, and preferably done 1 week after menstrual cycle. All right, so let's move to slide 9. I think we're done from here so that we can take questions. Okay, let's just, yeah, slide 9. Okay, orange pill appearance. Next slide. Nipple retraction, and then this one, you can see some area of redness. Okay, just below the nipple. It's not just the nipple that is retracted. There's some redness there. Yes. Okay. Next. Okay. Okay. We've seen this, slide 12. Okay. Good. Now, special considerations. Now, for people, ladies who have family history of breast cancer, right? Maybe first degree relative, second degree relative. You have somebody, a woman you are related to by blood, right? Who died of breast cancer. Now, not maybe a woman from your husband's side. No, not that one. From your own side. Maybe an auntie, sister, cousin, and all of that. Now, for them, right? Even if they don't have any symptom, okay, because they have a strong family history and all of that, we usually will advocate now for women who are above 40 years, with or without symptom, whether you're having symptom, you're not having symptom, it's good to do a mammogram, okay, a mammography, right? At least once a year. Okay, for people with strong family history who are asymptomatic. Okay, is in the family, you're not having any symptoms, there's no lump, there's no anything, just once a year, if you're above 40. Now, for women who are less than 40, we usually would ask them to do an ultrasound scan, right? The reason is because their breasts are denser, okay, they have more fatty tissue and all of that. So an ultrasound scan, will do a better job for us, all right, for younger women. So they don't have symptoms, right? But it's good to just do that, okay, maybe once a year. You go for the scan, just to check. All right, so let's go to the next one. Let's go to cervical cancer. Okay. Now, like I said earlier, cervical cancer is the second leading cause of death, cancer deaths, okay, in women in Nigeria. Okay. First, of course, is breast cancer. Now, the person could be asymptomatic, meaning the person doesn't have any symptom. And the only way, you'd find out is if the person is doing routine screening, okay, which is what we call a pap smear. Okay, now we advocate pap smear, for people, who are sexually active, one, okay, who from age, let's say 25 and above, okay, and then so pap smear routinely is done maybe once in every 3 years. All right, if the findings are normal, right? So if, for example, you do like a pap smear now, right, and then you find there are sometimes, in the early stages where it's not yet a cancer, but it's neither here nor there. Okay, they are not sure. Now they could schedule you for another one, okay, within a shorter period. Maybe they tell you to come back, okay, maybe next 3 to 6 months. Let's be sure of what was seen. Okay, but ideally you do a pap smear now and then it's fine, right? The next appointment should be, like every 3 years, right? Now, so what are the things, that point us to cervical cancer? Vaginal bleeding, okay, not just any kind of bleeding, irregular bleeding, okay, intermenstrual bleeding. You're done with your period, then after a few days, you're bleeding again, comes 2 days, 3 days, stops, you're having all of that. That's a red flag. Okay, post-coital bleeding, okay, after sex, okay, and the person will notice streaks of blood, okay, that's a red flag. Okay, post-menopausal bleeding, done with your period, and then blood shouldn't be coming out from there, and then all of a sudden, you start seeing blood. That also is a red flag. Now, if you're having vaginal discharge that is copious, purulent, and malodorous, Now, of course, there are this regular, just normal infection, discharge, that you could have and all that. That one is it's different. This one is that it's much and it smells really, really, really bad. Okay, but what we tell people is, look, you have any kind of infection, you are seeing discharge, you don't understand, run to the hospital. All right, don't wait till it becomes really offensive. You see, sometimes the discharge is mucopurulent. Okay, mixed with blood, discharge. Don't wait for that. Anyone, just be sure. Okay, because the idea really is that whatever is happening, we want to catch it early. Okay, that's the truth. Okay, our best bet in this part of the world is to catch it early. Okay, that's our best bet. Okay, now there are some late stages that come and you just know, well, you just do palliative and then you hope for the best. But if you can catch it early, sometimes you can achieve cure. Okay, that's the good thing. Whether breast, whether cancer, you catch it early. Some cases really early, you can achieve cure. All right. So another thing you're looking at for is pain. Some of them they feel pain in their rectum. Okay, they are pulling this, they're feeling some kind of pain. Now, when they start having rectal pain, for example, means that the thing has already moved from the cervix. This is not really an early sign. Okay, but then if you feel it, you need to go to the hospital. It means it has moved to the rectum, and then you're feeling pain. Maybe when you're pulling, sometimes you're not even pulling, but you're feeling pain inside there. Okay, it could be something happening in the cervix that's moved, backwards. Now, dyspareunia, okay, painful intercourse, okay, that's could be. Now, it doesn't mean that every painful intercourse is cervical cancer. No, that's not what it means. Okay, it also doesn't mean every rectal pain, okay, is cervical cancer. They're just things you look out for. Okay, there are red flags, and then you want to go check to be sure, okay, that it's not cervical cancer. Now, deep pelvic pain. Okay, you're just feeling pains deep, like your lower abdomen, deep down. There's a deep pain. That's how they describe, like it's just in there somewhere. You want to have that checked out. And then painful urination. Okay, that's dysuria. All right, next slide, please. Okay, slide 14. Okay, now frequent screening for human papilloma virus in sexually active women, especially for those with multiple sexual partners or partners who have multiple sexual partners. Let me explain. Now, one of the things is not the only thing that triggers what they call it now, cervical cancer, but infection with human papilloma virus, okay, has been fingered, okay, as one of the leading causes, but it's not the only one. Okay, now it doesn't mean if somebody has human papilloma virus, the person is necessarily going to come down with cervical cancer. No, okay, but it predisposes, to cervical cancer. Now, if it's promptly treated, it would not lead to that. Okay, it's the whole process of, the virus infecting the place, the body mounts inflammation to try to clear it, and then before you know, it starts, some changes start happening there. You have squamous metaplasia and all of those things, and then it becomes cancerous. Okay, that's really what happened. So there's infection there with this particular strain, HPV, and then the body is trying to clear it off, the inflammation and all of that, changes start happening. So now, if a woman doesn't have HPV, and then she has one partner, the husband, who also doesn't have it, they've checked themselves and they're faithful to themselves. Okay, it's good for them, it helps them. Okay, but when you have a woman who has multiple sexual partners, okay, increases the risk of being infected with human papilloma. Or she has one partner, okay, but that partner is not faithful to her. He has multiple sexual partners. Okay, so it increases her risk. So frequent screening for this HPV, okay, would help. So person gets screened, finds out, you have HPV, you get treated, and the treatment is actually quite simple. Okay, so now if we find somebody who has HPV, for example, right, we'll treat the person and then we'll send the person for a pap smear. Or I want to know, this HPV you're having, how far has it gone? Okay, and then they open the cervix, just open the legs, take swab from the cervix, and then they check it in the lab, and then they see what's going on there. Now, in the very early stages, right, there are things we can do Okay, things like cryotherapy, laser therapy, and all of that. Okay, but it's as it begins to advance, but like I said, there's something called CIN, cervical intraepithelial neoplasia. Now, it's not cancer yet. That's what pap smear will tell you. Okay, the stage of the CIN. Okay, now depending on the stage, right? Those very early stages, okay, we can do loop electrosurgical excision procedure, or do laser therapy, or do cryotherapy, or as it begins to advance, we'll now begin to consider things like hysterectomy, for women that are done, with childbearing. And then, of course, the pap smear we already talked about, once every 3 years. Okay, if person has normal, donor is normal, till you come back the next 3 years, and then we check it up. I think I'd like to stop here so that I can take questions.
Thank you very much, Dr. Augustine Osayuki, for that wonderful lecture. It was really, really educative, informative. It was well equipped with diversified information as a guideline. But you said if we notice it early, it goes a long way to help us.
Yes.
Please, before questions, we'll want to quickly take a group photograph, honestly, please, so that
Okay.
we can come back for questions. Thank you.
All right, ma'am.
Cheers, please. Are you there? Cheers, Dr. Runosha.
Okay, I'm here. Yeah, good morning once again, and thank you very much, Dr. Augustine, for that informative lecture. Yeah, before we go to the Q&A session, we kindly implore all our participants to please enable your video so that we can take the group photograph for today's webinar. Please just enable, turn on your video. Let's see the beautiful faces behind the names. And while you're doing that, you can please, for the question section, if you have any question, you can drop it in the chat room, or you can use the virtual raise hand button and you'll be called upon to ask your question. Yeah, please after the count of three, I'm gonna take the first shots. Yeah. We have only one shot anyway. Yeah. So please let's keep it coming. Okay. I will take the photograph after the count.
Technical, I'm sorry I cannot turn on my video. So I got a photo out there. Thank you.
No problem, ma. We understand that, ma. But you can see, yeah, your beautiful pose too is well representative of your personality, ma. Thank you very much, ma. So I will take yes, ma'am. So I will take the group. I will take that now. Okay. Yeah, thank you very much. So now it is time for the Q&A session. If you have any question, you can please use the raise hand, the virtual raise hand button for your question. You can drop it in the chat box. Okay. Any question? Okay. I have a question, Dr. Augustine, and my question is this. You talked about a special case of people that have a cancer history in their family lineage. So and you recommended that pap smear should be done every 3 years for women. But for people that have this special history, so how often do you think they need to get screened against these abnormalities, cervical cancer, breast cancer is at least that one, everybody can handle that. But for the major one, how often do they need to get screened? And where in Nigeria can we have this done? And maybe you should also give us an idea of the cost. Because I know cost is another major consideration. Yes. Then everything borders on money. So that's my question.
Okay. For people, when we're talking about genetic predisposition, it works more for breast cancer. Okay, for cervical cancer, it's not been established firmly as it has, okay, for breast cancer. And so for people who have, family history, okay, but are asymptomatic, meaning they are doing their breast self-examination, they don't see anything, they don't feel anything, okay, and then they are above 40, you could do, like I said, mammography for them. You do a mammogram, okay. It's a special kind of x-ray for the breast, okay. Then for women who are less than 40, because of the density of the breast, the fat tissues, and all, ultrasound scan. Well, ultrasound scan, I don't think, um maybe 8,000, 9,000, 10,000, depending on, so, but it's not, that is not very expensive. I think a mammogram is a bit more expensive, again, depending on the center. Some places, I think there are places they do it for 40K, 45K, okay, but it's not something you do every day, okay. And knowing that if you catch it early, because the truth is, is teaching nine actually does save nine. Okay, if you catch it early, that's maybe 20K, 30K, 40, 50K that you're spending maybe once every year, because people with strong family history, okay, above 40, we say, look, try and do this in every year. I mean, just once a year, so that is nothing really, okay, compared to what you will spend, okay, if it becomes full-blown cancer, and then you start talking about chemotherapy, radiotherapy, which in this part of the world is still relatively expensive, okay, for the average person. Okay, now when I'm talking about chemotherapy, radiotherapy for the average person, but there are people who are other maybe HMOs and NHIS, make it relatively cheaper. So if somebody has a problem, has difficulty maybe bringing out 10, 20, 30K for a routine screening, I'm sure the person will not have 500K or 1 million for chemotherapy, okay, and the likes. So that's it. So for the family history, no symptom, okay, you want to do mammogram every year, okay, but less than 40, you want to do a routine ultrasound scan, which is way cheaper, way cheaper than the mammogram. Thank you.
Okay, thank you very much for that beautiful response. Yeah, I'm still waiting for others to ask questions, but since I can see no hands up, so maybe I should go ahead and ask my next question. Yeah, because you talked about a recent spike in the number of cancer cases that we have in Nigeria from from the statistic you have from your center. So what do you think? I don't know, maybe from your medical research or from your space, what do you think would be the causes, or what are some of the causes of a recent spike in the cancer cases that we have in Nigeria? And how can we not mitigate this as individuals? Because I know there are so many myths around cancer that we're seeing on social media every day. But you talking from the medical point of view, what do you think? What are some factors that are responsible for this? And how can we, as women, because it is our world, so how can we mitigate this as an individual and as a community?
Okay, now the thing is, um most of what we have, actually, they are still speculations, okay, that's the truth, okay, because first question is, what causes cancer in the first place? Okay, what we have, okay, theories here and there, now, then the answer used to be that, okay, as you're getting older, okay, your cell cycle, begins to malfunction, then the protector gene, the P53 gene, is no longer as active as it should be, and then, you know you start having cells multiplying abnormally without control. But now that we've seen it, in younger people, that explanation cannot hold. Um, okay. Now, one of the other speculations that, if you ask me, I think makes some sense is the change, okay, in our what we eat. Okay, like I said, this is also speculation. Now we're doing more of processed foods now. We're doing more of canned foods, and all of those things. so some of those things are actually carcinogenic. Okay. So of all the speculations, I think that's the one that seems to hold water. Okay, that the way, like, maybe 30, 40, 50 years ago, our parents, they did more of natural stuff. I'm sorry, grandparents, great grandparents, but right now the things we eat, we're doing more of processed foods, and all of that. That is a likely explanation, for the sudden surge, in younger age group. Now, some people have even said that, maybe, there's this recent debate about GMOs, and all of that. But even that, is still neither here nor there, So, but all of those things, they are speculations. Okay, that could be the possible explanation.
Yeah, thank you very much. I think there's a question from Moazu, Engineer Moazu she just dropped it in the chat box. She said, thank you so much, Dr. Augustine, for this informative presentation. Most times people are not being advised on the type of diet, especially when the cancer is being discovered early. So what are doctors doing in this regard to create awareness on what to eat and what not to eat?
Okay. Now, the thing is, um, you can advise somebody if you think that there's a direct link between cause and effect, established link, not some kind of speculation. Okay, but the truth is, what we still have, for the most part, is speculation. Okay, that's the truth. Okay, but generally, okay, we tell people to avoid processed foods as much as possible. Okay, things like hot dogs, processed foods as much as possible. Because I don't think it's possible 100%, but as much as you can. So you avoid, that's what I do. Okay, tell my people, look, try and be as natural as possible. Okay, but now the problem now is people who are advocating and saying that they think GMOs, okay, food that are genetically modified, you know, they fingered it. Now, like I said, that one is controversial. Okay, it's not established yet. So if, for example, I'm told, that they've approved GMO beans in Nigeria. Okay, it's been in circulation since, let's say, I think 2019. Now that is supposed to be natural. It's not processed. It's food. So you want to tell somebody not to eat beans? Like, do you understand? So, but ideally, the processed foods, avoid them, as much as possible. I think for me, that's what we tell people generally.
Okay, yeah, avoid processed food. Thank you. Yeah, there's a follow-up question to that. And the question is, there are so many awareness about taking hot lemon water on empty stomach first thing in the morning. I think I've seen this in the news. Yeah, when you go to Facebook, you see this a lot of. If I these days, I think we have more doctors, more registered doctors than the registered one in this space. So, how true is this claim? How true is the claim
Now,
of taking hot lemon water first thing in the
lemon.
morning?
Okay. Okay. Now the truth is, I've heard many things. Okay. It's just that the one we advocate for is the one that has gone through testing, has been proven over time that this thing works. But personally, now here's what I think. I feel like some of these things actually work. Okay, but of course I can't push it. I can't, because it has to be established scientifically, and then you subject them to clinical trial and all of that. They will now say, okay, well, we'll start pushing it. Okay, but some of these things, not just with maybe cancer. For example, I have patients, not one, not two, not three, that have come to tell me that for, let's say, diabetes, for example, that there's this thing they do with is it okra water or something, and then the thing normalizes. I've also had patients that come to tell me that they take beetroot, okay, and it lowers their blood pressure. Now, so some of these things, I believe somehow in my heart, I feel like some of these things out there actually do work. Maybe most of them don't, but I feel God, in His wisdom, put some of those things there, and then it looks like people are stumbling on it. But then again, these things are not things that, as a doctor, I can say do or don't do, because we've not subjected it, to clinical trial. So that's the thing with some of these. They could work, it's possible, but since we've not established whether it does or not, we can't push it, medically.
Yeah. Thank you. We have our past president, Engineer Dr. Patricia Okmeni-Odili, hands up. Ma'am, you can take the virtual stage, ma'am.
Thank you so much. Dr. Austin, I am so proud of you. I
Thank
am
you.
I am so proud of you. You just said something that made my heart warm. God in his mercy has placed fruits, herbs, spices, everything on the earth for us.
Yes.
More and more people are stumbling upon it. I respect your profession. I know you guys are out there helping us to live a better life. And I thank you for being so honest with us today.
Yes,
More and more people are stumbling into it.
yes.
I am a research fellow. I do a lot of research. And just as you said, until it goes through the testing, the scientific testing, and the medical board agrees that this is true, you cannot say it works. But it does work.
Yeah.
And I'm
I
grateful
believe it.
for being so honest with us this morning. God bless you, very good.
Thank you. Thank you.
Thank you very much, Ma, for that contribution. Yes, I think every solution to our problem lies in nature. So, but how far we can research it depends on how we get knowledge. Thank you very much, Ma. Yeah, we have another contribution from the Vice President of the Association Engineer, Chinyere Nena Igwegbe, says cancer thrives on sugar. As much as possible, avoid sugar. Lemon
Okay.
especially alkaline product helps. I think that aligns with Dr. Augustine's submission.
Now, the thing about cancer thriving on
Okay.
sugar, that one is actually still very controversial. Okay. There are some studies that suggest otherwise. Okay. The thing is, okay, if you think cancer thrives on sugar, okay, and then you want to avoid sugar, it's what is sugar really? Okay, because assume in this context, sugar, you're talking about literal sugar. Okay, but all of those things like your yam, your carbohydrates generally, your body breaks them down to sugar, okay, which is glucose, which your body needs. Okay, so are you saying that you want to avoid carbohydrates completely? Okay, and all of that, or you are referring to just processed sugar. But then again, if you believe it thrives on sugar and then you have alternatives and then you want to do it with it, for me, it's fine. Really, I mean, if you think, why not avoid it? You won't die. Let's take, okay, herbs is the way. Okay, herbs. Now the thing with herbs, I believe herbs work. That's the truth. Okay, it's just that the way we take it in Nigeria is the problem. Okay, I mean, you see people walking around with things, they mix all manner of things. Now, let me use neem tree for example, what we call dogonyaro, the one they use for malaria. Okay, somehow people just accidentally, people were just using it and they found out that it works. It was later on I found out that look, that thing contains quinine, right? So that's why you can use it for malaria and it will work. Now, if you take a typical herb, for example, okay, and then this thing they call agbo, you mix it, you cook it, and all of that. Now, the thing you're trying to treat, right? It could treat that because it has the active ingredients, okay, in the leaf. But the problem is, what it has is not just the active ingredients. It has many other things, right? Some of which could be harmful to your body. Okay, so it's that I mean, even our conventional drugs, most of them they're from herbs. Okay, herbs that were processed, you remove the harmful parts, and then you now bring out the active ingredients so that if the person is sick, what the person needs is quinine. Give the person quinine, and then it works. So if you're advocating that, okay, herbs generally, processed herbs, okay, you have taken out all of the harmful stuff and then you single out, you isolate the active ingredients. It's perfect. It's not that when you say herbs, people just go pluck something, mix it with one thing, cook it, and then it takes care of the immediate stuff, right? But in the process, they've ingested other things that their body doesn't need at that time, and then it causes them, other problems. So that's the issue with, herbs, and all that. Yes.
Thank you, thank you. So, I think we have a requirement to that. Moderation is the word. So we have to regulate it, or else, while trying to solve the problem, you can even introduce another one that be more complicated. Thank you
Yes.
very much. Yeah, before I take Engineer Adeyemo's question, we have Engineer Ademola's Olonfemi hands up, one of the past ESCO of Niger State of Engineers. So we are the Engineer Ademola Olonfemi, sir. You can take the floor, sir.
Yeah, thank you very much. My president, my past president, for 3 or 4 hours, but I had made up my mind to attend this. And interestingly, it's that one going on. Uh, SPO Foundation, one of our colleagues in the UK, whose wife cancer. I'm sure I will link the two among both meetings because one, this is very important. The women are wives, mothers, and children. I'm privileged. I have 4 women in my house, so I'm going to share these two things with them. I congratulate Upwell. Dokita, well done.
Thank you.
Much, sir, for that sense of fellowship. Yes, that ready to boast you whenever you're ready. Thank you very much, sir. Engineer says, okay. Sorry, before I close, I think there was a question that I have not taken after which once I take this question, Engineer, so sir, you can please get ready to take the virtual stage for the next item that we'll have on the agenda. And the last question is for someone who has been diagnosed with early stages of cancer, what can she do to recover completely? Doctor.
Okay. Okay. So let's start with, let's say, breast cancer, right? Now, if it's really, really early, okay, there are things the person can do. Now, we can do an excision biopsy, okay, meaning the person found the lump, and then we go surgically, remove the entire lump, and then of course we send to the lab, and then we wait for the histology results. Now, if it is confirmed that it's a cancer, now, if it was really early, right, that removal can be curative. Okay. Now, but the truth is, defining whether that removal was curative or not is something you do in hindsight. And I don't think you want to do that. Meaning that, okay, fine. You saw a small lump, and then the lump was removed, with some surrounding fat tissue and all that. There's no way to tell 100% that some of those cancer cells have not left that lump, that you removed. So what we do, if it's really small and then it's still freely mobile and then it's not fixed yet to the chest wall, okay, we'll do a surgical excision, an excision biopsy. Okay, but by the time you have a mass that is already fixed to the chest wall, we don't bother removing it. We just do a core biopsy, take a very little part of it, send it for histology, and then that's where we come in. If the histology result is cancerous, and then we can offer you chemotherapy, and then or radiotherapy. Now, for cervical cancer, right? Now, if it's really early, okay, there's stage 0, CIN stage 0, okay, there's laser therapy. Okay, person can be offered laser therapy. Okay, person can be offered cryotherapy to that spot. Okay, now, but as it begins to progress to CIN 1, 2, 2A, 2B, 3, like that, we favor more of when it's stage 1, stage 2. Okay, we want to do most times hysterectomy, and then remove the lymph nodes there that are affected, and then we still send for chemoradiation. Okay, because again, we're not sure, because some cancer cells may have left the primary site, they've gone somewhere, but they are not replicating yet. So we remove. So it's just that when it gets to like stage 3, okay, and then there's already, it has invaded the cervical mucosa and all of that, and then we don't want to remove, do a hysterectomy. We just send straight, for chemo radiation. Okay, so for somebody who is really early, really, really early, okay, breast cancer, excision biopsy, then can just give you maybe neoadjuvant chemotherapy, just a little here and there, just in case there are some other ones that have spread. So that's what we do.
Okay, sir. Thank you. Engineer, so sir, thank you very much, Doc. And maybe you can just drop your details in case some of our participants still want to have a further conversation on this, post this webinar. And drop your details you can drop it in the chat room for people that will be interested in continuing this conversation. Engineer, so you can please come on board for the next item. Time is fast spent. Thank you.
Wow. Once again, thank you very much, Doctor, for
Thank you,
that
ma'am.
wonderful presentation. It was really, really insightful and very impactful. God will bless you.
Thank you,
Now,
ma'am. Amen.
our other program is presentation of certificate as an appreciation to you, and that's to be presented by our amiable president in person of Engineer Dr. Adebisi Osim.
Thank you so much, the moderator.
Sorry.
Dr. Augustine,
Sorry,
I appreciate you.
I'm
It's
coming, please.
well educative, insightful, and I believe when women follow all this advice, we'll be taking away cancer from our generation. Thank you so much. We are proud of this information, and we will make sure we keep our family members, our friends about all what you've told us, and we have the opportunity to invite you more to speak in a larger gathering.
Thank you, ma'am. Thank you.
On this note, I will call our 8th president, the past president of APWE, to do us honor to present this certificate to you, Dr. Augustine. Engineer Patricia Opono Deliver, please present the certificate.
Thank you very much. On behalf of the President of APWE, Engineer Dr. Adebisi R. Osin, the executive, all past presidents, all founders, I present this certificate of presentation to you for doing us this honor and bringing to our homes a couple of answers to all the questions that's been nagging our hearts. So we thank you, and we're very blessed with this lecture this morning. Thank you.
Thank you.
Thank you so much, our past president of NSC, Engineer Olorufemi, for being in our midst. We are really honored to have you. Thank you, sir. Thank you so much, Engineer Aramide. I saw your name on the platform. Thank you so much. So the host, you have the floor.
Well, we're bringing this webinar to a close now. Thank you very much, every one of us present. I want to call on our Vice President, a person of Engineer Inena, to please give a vote of thanks. Thank you.
Sorry, can I just say something before?
Go ahead, sir. Go ahead.
Okay. Thank you very much for having me. I'm truly honored to be in your midst. I think I'm an engineer now by association. Thank you. I just want to reiterate that catching cancer early is our best bet. Okay, and if we can push people to get screened, do simple breast self-examination, it can go a long way. Hopefully it doesn't get to the point where it becomes, really bad, but if you can push, for me, the key word is to educate people, okay, to do some of these really simple things, so that, they don't come now. We've had people that came to our center, okay, and I mean, they were cured. I mean, complete cure. They achieved complete cure, okay, and it's one of the things that helps them. Some of them presented early, but some of them that even presented late, miraculously. I mean, we did, what we could do, and then, trust God with the rest. And then they too achieved cure. Some of them that even had metastasis, they've had spread. Some of them breast cancer spread to the brain, other body parts, and then, but somehow all of that, was reversed. We gave chemotherapy, and then with our therapy machine, we gave all of that, and then, they achieved cure. But the key word is, getting people enlightened, okay, so that, they take some of these really, really simple things seriously, so that, God forbid, it happens, they catch it early, and then, they can achieve cure. So thank you very, very much for the honor. I'm truly grateful. Thank you very much.
Thank you, Dr. Augustine, for that wonderful rendition to end your presentation. I want to appreciate all the people that came today, our president, ISCO members, founding members, past presidents, members, and guests. This yet another wonderful presentation that we are receiving, and from every indication, it behoves on us that we have to carry on with this advocacy. And I want to appreciate the team, the technical team led by Engineer Dr. Rino Shaw. We want to say thank you for Upwen, and we hope that before the end of the month, we'll have another series under health. Thank you all and have a wonderful day. God bless us all.
Thank you very much, Engineer Nina. Please, before we leave, we're going to raise third standard of the national anthem as our closing prayer. Okay.
Oh God of all creation, help us to be the nation where no man is oppressed, and so with peace and plenty.
Nigeria may be blessed. Amen.
Amen.
Thank you all. We appreciate you all. Have a nice day. God bless you.